Hello and good afternoon, everyone. This is Michelle Noth-McCready, and I'm the Policy Director here at Child Care Aware of America. I would like to welcome you all and thank you so much for joining today's webinar presentation. Child Care Aware of America's webinar series is a 5-month campaign to help fuel the conversation around various opportunities that enrich the state of child care and early education in this country. The Raise Your Hand webinar series strives to raise awareness about federal and state early learning opportunities that support childcare, connect participants with content experts, and inspire all who care about early learning to take action to better the lives of working families. And speaking of content experts, we are very excited to have a special guest with us here from 0 to 3, Jamie Colvard, who is the Senior State Policy Analyst there. Jamie will talk about a very dear topic to the child care community, which is home visiting and how it can be an effective method of delivering family support in comprehensive and coordinated ways in the early childhood system. And before I turn it over to Jamie, I wanted to point your attention to the chat box function on your screen, and it's located on the right side, and I hope you all can see it. Please be sure to use this function throughout today's presentation to type in any questions or comments you may have during the presentation and as they come up so you don't forget anything. And we'll be sure to include them in our question and answer portion at the end of the chat box. And just a couple more things. We are recording this webinar, and it's going to be available on our YouTube channel, which I will pull up at the end so you know where to find it. And I guess that's it for me. Without further delay, I'm going to turn it over to Jamie. And again, thank you all so much for joining. Jamie?
Thanks so much, Michelle. Let me just get my slides up. Okay. So thank you so much for having me here today to talk about how states are integrating home visiting into their comprehensive early childhood systems. Before we dig into our topic, I just want to share a little bit about 0 to 3 for those of you who are not familiar with us. So 0 to 3 is a national nonprofit organization. We're based in DC, and we're devoted to strengthening bonds between research, policy, and practice by translating what we know from the research into what we do for infants, toddlers, and their families. We were founded 35 years ago by leading researchers, clinicians, and thinkers in the study of infancy and the early years, and our work focuses in 3 main areas. We train professionals from a range of disciplines who support young children and their families. We help programs achieve best practices and guide the design of systems that support those programs. And we advocate for policies that aim at promoting healthy development for infants and toddlers. The 0 to 3 Policy Center, of which I'm a member of, is a nonpartisan research-based resource for policymakers and advocates on the unique developmental needs of infants and toddlers. While our public policy work is a relatively small part of what the organization does as a whole, we leverage really critical changes. We engage the public and policymakers at both the state and federal levels to both help them understand the importance of the early years and the role that public policy plays in promoting young children's healthy development. We've been doing a lot of outreach and advocacy around President Obama's Early Learning Initiative and the Strong Start for Children Act that was introduced recently. And if you haven't seen our resources around those initiatives, I encourage you to visit our website and visit the Rally for Babies section. It explains the Strong Start for Children Act and how you can get involved in advocating for funding for that act. So to ensure a good start in life, we know that all children need good health, strong families, and positive early learning experiences. In order to achieve these outcomes, we need policies and programs that promote each of these areas. And so this policy agenda was developed by 0 to 3 to sort of lay out what we think young children need, and we use this to guide our work at the policy level. So we know that infants, toddlers, and their families need physical and mental health services, such as insurance coverage, prenatal care, primary and preventive care, and developmental screenings to identify physical and behavioral needs. We know they need family support to help parents meet their basic needs for their families. We need high-quality parenting education and home visiting. We need developmentally appropriate child welfare services, and we need paid family leave. And then we know we need early learning programs, such as high-quality child care in a variety of settings, early Head Start programs, and early intervention services for infants and toddlers who have developmental delays. Beyond a simple menu of programs, however, services need to be high quality, culturally responsive, inclusive, and accessible and affordable to all the children and families who need them. And they really need to be integrated within an early childhood system. So to do that, beyond just having services, the services need an infrastructure to support them. And this slide shows kind of our idea of the equation that makes up the system, the services and the infrastructure. And you can see that we think the infrastructure includes some core functions, such as defining and coordinating leadership so that there's a shared understanding of the roles that different programs and leaders play, and that everyone involved in the system is moving toward common goals. It's important to recruit and engage stakeholders so that you have a diverse constituency that's in support of the early childhood system. We know, especially in times that we've been in recently, it's really important to finance strategically and to think through fiscal policies that move systems toward delivery of services in a comprehensive manner and that provide financial incentives for ongoing quality and system improvement. We also know it's important that we have standards that are aligned, that can integrate services and practices across systems where it's appropriate, and that we're ensuring accountability by designing data systems that track progress on outcomes and benchmarks. So together, the services and infrastructure really create the system, which is the glue that holds those complex set of services together. And this will look different in different states because the context and the needs of their citizens will be different. One of the primary focuses of the Policy Center's work and my work with states is to help them think through this system building aspect. So let's turn to our topic for today, early childhood home visiting. Research has shown that home visiting is an effective method of supporting at-risk families as they guide their child's development, particularly when it's a part of a coordinated system of services like I just described. These voluntary programs tailor services to meet the needs of individual families, and they typically offer regular one-on-one visits during which home visitors offer information and guidance and support directly in the home. And this delivery model can really help overcome some of the traditional barriers to service delivery when families have to go to different offices or sign up for different services that has some negative problems sometimes in terms of finding transportation or needing childcare, those sort of things. So home visiting can sort of overcome some of those challenges. While home visiting programs vary in their goals and content of services, in general, they usually combine parenting and healthcare education, child abuse prevention, and early intervention and education services for young children and their families. Home visiting programs support parents as their children's first teachers. They help parents identify and understand their children's developmental needs, and they connect families with other supports. And that's really one of the critical roles that home visitors can play by connecting families to health care, to mental health care, and economic supports. So although home visiting programs vary in their operation, some may employ nurses, others use paraprofessionals. They vary in their target populations and in sort of the length of time that they serve families. Over time, we've identified some key outcomes that sort of cross models, and some of those are listed here on the slide. So depending on the home visiting model that you're implementing, you could see positive outcomes for children and families, either some of these or all of these. And I'll just go into a little bit of detail on these. Home visiting programs have been shown to increase school readiness for children, such as by increasing their early language skills or their vocabulary. We've seen better health outcomes both for children and for mothers. Pregnant mothers who are involved in home visiting are often more likely to receive prenatal care, and so that then leads to reductions in preterm births and low birth weight babies. And it also improves the health for mothers because they're not only being connected to health care while they're pregnant, but home visitors can connect them to health care after their baby is born and deal with any postpartum issues they're experiencing. We see that then there's an increase in children receiving their well child visits and getting their immunizations when they're connected to home visiting. Some home visiting models are also shown to reduce child abuse and neglect and increase family economic self-sufficiency. So home visitors may help parents get their GED or take college courses or even work on their resume and apply for jobs. Home visits are really an important mechanism for improving the capacity of parents to support their children's development. Home visitors can help parents better understand how they can use everyday activities to kind of help their children learn, like helping them understand the importance of reading to young children even when they're too young to really pay attention to a book, or singing with them and having conversations with them. Some home visiting programs have also been shown to have long-term impacts, such as increased graduation rates and decreases in crime. So recognizing the many positive outcomes that home visiting programs can have for children and families, the federal government made a significant investment in 2010 when they created the Maternal, Infant, and Early Childhood Home Visiting Program, or McVie. And this was created through the Patient Protection and Affordable Care Act. And what it did was provide $1.5 billion over 5 years to states and territories to improve the health and development outcomes of at-risk children through evidence-based home visiting. And it's important to note that that money is mandatory funding. So in the midst of all these crazy budget negotiations that we've had recently, this money is well protected. So since McVie was enacted in 2010, it's been implemented in 544 communities in all 50 states, D.C., 6 territories, and numerous tribes. The majority of funding is used to implement program models that have demonstrated their effectiveness based on rigorous evaluations. So when the program was created, the federal government also launched the Home Visiting Evidence of Effectiveness that conducted a review of all the home visiting literature to determine which models met certain criteria for being evidence-based. And there are currently 13 models that meet this criteria, and those include some that you're probably familiar with, like the Nurse-Family Partnership, Parents as Teachers, and the Early Head Start home-based option. States can use their remaining funds to implement promising approaches, and these are other home visiting models that might not have been evaluated with the same level of rigor as those that are already considered evidence-based. And so states that implement promising approaches also need to use some of their grant funds to evaluate those programs. So McVie really provided significant new resources to states, and this led to the addition and expansion of home visiting programs in communities across the country. Resources are also being allocated to expand the infrastructure that supports home visiting and to better integrate home visiting into the broader early childhood system. And I did just want to note that 0 to 3 also operates the McVie TA Coordinating Center. So we have TA specialists that work with the state grantees to kind of help them think through their home visiting system. So what does home visiting look like in the states today? States are in really different places in terms of their home visiting systems. Some have had home visiting programs active in their states for decades, while others had very little prior to McVie. And even if they did have home visiting, it may not have been driven by the state. So home visiting in many places was developed and sort of driven at the community or local level. And so as states are now working with McVie funding, they're also trying to bring in all of those community-led programs as well to really think about the system as a whole and connect all of those various models. States also didn't necessarily have programs that meet that evidence-based criteria. So they're sort of thinking through how to address that now. And we've seen several states in the last couple of years begin to pass legislation that puts new requirements on state funding for home visiting, saying that it can only be used for programs that have proven their effectiveness. And some states are sort of using the Fed's criteria and definition of evidence-based to make the decisions about how state money is used, while others are creating new standards to outline how the money can be used. But regardless, they're really putting a new focus on accountability, whereas previously states didn't have as much of a focus on that. And like I said, many states are implementing multiple models, so they're really thinking through how to kind of build a system that fits all of them and supports all of them. Through McVie, states have named several priorities that they're working on right now, and I just wanted to briefly mention them because they are a good place to kind of jump off of when thinking about how home visiting can be integrated into the broader early childhood system. So you see here on the slide, some of the priorities are thinking about benchmarks to show that they're making progress towards outcomes and creating data systems to track those outcomes and indicators. States are developing core competencies and training for home visitors. They're thinking about how to create centralized intake and service coordination mechanisms so that they can connect families to the right program or model. And then they're spending a lot of time thinking about funding and sustainability because although we see positive signs that federal money for home visiting could continue beyond the 5 years that were originally authorized, there's certainly no guarantee, and so states are thinking about how they can, sustain things if federal money isn't what they think it's going to be in the future. So states have made a lot of progress developing a system of the various home visiting models, but less has been done to integrate home visiting with the broader early childhood and health systems. And you'll see on the slide here a few areas where states are doing some work to build those connections. This definitely is not an all-inclusive list, but it gives you an idea of where some of the opportunities are. And so I'll share some of the strategies within each of these areas and give you a couple examples of states that are doing work in these areas. So in a lot of states, home visiting stakeholders have not historically been engaged partners in early childhood system planning. And there's a handful of reasons for this. Like I mentioned earlier, home visiting may be new to the state, or the state level involvement may be new. State early childhood systems often sort of began or are driven more by early care and education, and so states are in different places in terms of how they've broadened that and made connections across to other systems like health and child welfare. And home visiting is often run out of a different agency or department than other early childhood programs, and so that can sometimes pose some challenges to building those connections. But many states are taking steps to ensure home visiting stakeholders are involved in collaborative planning and system building. So one strategy that they're using is to create stakeholder advisory bodies for home visiting that include representatives from early childhood services like child care and early Head Start, child welfare, as well as parents, and that these groups are then playing a role in how the home visiting system will be developed. And by having all of those people together in the same place, it makes it a lot easier to sort of identify opportunities for connections. Arizona created a Strong Families Home Visiting Task Force that has 82 members from 45 different organizations that plays this role. they also created a Strong Families Home Visiting Alliance that pulls together people from all the different home visiting models and programs to think through how they can build connections. Another strategy is to include home visiting stakeholders in state-level coordinating bodies, such as the Early Childhood Advisory Councils. Illinois has done this, and they actually created a home visiting task force as a standing committee of their Early Learning Council. And they also located McVie in the Governor's Office of Early Childhood Development, where some other early childhood programs are housed as well to really make it easier to draw those connections. The last two strategies here are somewhat related. The first one listed there, conduct strategic planning, is really talking about the early childhood system as a whole. So several states are bringing together stakeholders that include people from all the services and programs that touch young children and families to think through the vision for the early childhood system as a whole and discuss sort of how everyone contributes to that vision and where everyone fits in. And when that happens, it's just important to make sure that home visiting is at the table. West Virginia is currently developing an early childhood plan, and they've been really good about intentionally involving home visiting in the group that's working on it. And then integrating home visiting in other early childhood campaigns. So an example of this might be if your governor is pursuing a school readiness agenda, how does home visiting fit into that? And how can home visiting be shown as part of the continuum of services that will help young children reach that goal? I mean, often school readiness is thought of both as only related to maybe preschool age children, but also then only early care and education. But you know, we know that development of young children and school readiness really relies on so many different domains. And so kind of playing out very clearly how home visiting and all the other services can impact that is really important. The state of Washington has regional early learning coalitions that focus on improving outcomes for children 0 to 8. And even though their focus is a broader age group, they're really doing a good job of thinking about how home visiting fits into their continuum. I mentioned earlier that many states are exploring centralized intake systems to identify families and connect them to the appropriate home visiting programs through McVie. Some states are taking this idea a step further and thinking of ways to identify, screen, and refer families to a much broader range of services and supports, and that can include early care and education, government benefits like food stamps, parenting supports, health care, etc. One example of this is Connecticut's Help Me Grow initiative, which some of you may be familiar with. There are 19 states that are now implementing this model in part of the state or the full state. And Help Me Grow doesn't provide direct services. Rather, it's a system for improving access to existing resources and services for children birth to 8. And they do this by building collaboration across sectors, including child health care, early care and education, and family support. And they conduct outreach to physicians and communities and organizations and create centralized information and referral centers. And those are used to link families to programs and services. Georgia is implementing an interesting centralized intake system where they are analyzing birth certificates to identify families that might be at risk and then referring them to home visiting programs, as well as other programs. The second strategy here that I listed is to develop community hubs to deliver multiple services to families in a single location. And this is a strategy that we saw a number of states are doing through their Early Learning Challenge grants. And they're using this strategy to really bring services to communities with large numbers of at-risk children where the capacity for services might be low right now. And so by putting everything in a single place, they're trying to make it easier for families to access those services, as well for them to sort of coordinate with each other. An example of that is Maryland. Maryland created 2 community hubs in under-resourced communities in Baltimore. and they provide and coordinate services for families with children birth to 5. And their hubs provide a wide variety of services to pregnant women, parents, and children. They also conduct outreach to child care providers in the area to engage them in professional development, and they help to make transitions from early care and education programs then into the schools a bit easier. The third strategy here is to use common forms like applications, screening tools, and referral forms across programs and services. And an example of this is in Vermont. Vermont's Children's Integrated Services System brings together Part C, early childhood mental health, nursing and family support, home visiting, and specialized child care services in the Department of Children and Families. And they have regional coordinators that oversee multidisciplinary teams that get together and discuss a family's needs and come up with a comprehensive service plan with the family. And there's a template for doing this so that everyone is working off the same document, and they use that document to document when services are delivered, how they're coordinated, what follow-up needs to occur, so that everyone's sort of on the same page. So professional development is an area actually where I think child care stakeholders have a lot to share as home visiting works to develop a PD system. States have done a lot of work in this area for child care professionals, creating core competencies, credentials, continuing education, training, and credit-bearing courses, registries, etc. And so the lessons learned from that process could be really helpful to home visiting. Many states are in the process now of developing core knowledge and competencies for home visitors and supervisors. They're also designing career pathways for home visiting staff and looking at how those relate to pathways in other early childhood fields. Instead of focusing only on home visiting professionals, some states are also identifying the core knowledge that all early childhood professionals should have, and then trying to go in more detail for the specific disciplines. So Nebraska developed integrated competencies for professionals across early care and education, early childhood mental health, and home visiting. And in that, they identified 11 universal competencies, and then they outlined how they might look differently for people working in each of those disciplines. And the intent of doing this was really to demonstrate that universal competencies are relevant to the work of all 3 disciplines, but they look different in practice. States are also developing joint training opportunities for early childhood professionals. And when it comes to home visiting, the place that many states are starting is looking at training for home visiting staff and Part C staff, because the programs are very similar. In Virginia, training modules developed by child care, Part C, and substance abuse agencies are available to home visitors as a way for them to meet their home visiting core competencies. And Nebraska, in addition to the competencies that I talked about a second ago, they developed some online home visiting modules that sort of cover the core training that home visitors have to take, regardless of which model they're implementing. And these modules are used both for home visitors and Part C workers. And then Iowa is developing a child abuse prevention certification process, and they're developing that training using their home visiting core training sort of as a starting point. The third strategy I have listed here is to integrate home visiting staff in the broader early childhood PD systems. States are really in the early stages of thinking about this, whether home visitors should be included in registries, whether their training should also be included in online portals and those things. So I think there's a lot that child care professionals could really provide for that conversation. So one of the key requirements of the McVie program is that states engage in continuous quality improvement. And they're required to collect a large amount of data to show whether or not they are making progress on a series of benchmarks, like improved maternal and newborn health and prevention of child abuse. So a few of the strategies that home visiting is using, or that the early childhood system as a whole is using to improve quality, are listed here. So the majority of states now have early learning guidelines for infants and toddlers that outline what children should know and be able to do across multiple domains of learning. And using ELGs as the foundation for other parts of the system, like professional development and QRAS indicators, is a good way to both ensure that practices are developmentally appropriate for young children, but also that there's consistency and continuity across the system. So Pennsylvania right now is developing their core competencies for home visitors, and they're using their learning standards for early childhood as sort of the foundation for that to ensure that they'll reflect best practice. The second thing I have listed here, although no state is using their QRAS system right now to evaluate home visiting, New Mexico, Connecticut, and Vermont are all considering whether that would be a good idea, and if so, how they might include home visiting programs in their QRAS, or if not include them, how they might develop something similar. So it's a very early thing that states are starting to think about. And then the third strategy here is that home visiting is some states are pairing home visitors with health, mental health, and infant-toddler consultants when they're doing their work. And we've seen that this has been an effective way to improve quality in child care, so it could work very well in home visiting too. An example of this is in Louisiana, where nurse-family partnership nurses are trained in infant mental health, and half of their local teams include a mental health consultant. And these consultants are providing direct services to the families, and they're also providing consultation to the home visitors on the team. And the state is beginning an evaluation now to sort of see how the teams that have these consultants, whether their outcomes are different than the ones that do not. So the last area I wanted to talk about today is evaluation. And we know that in today's climate, accountability and evaluation is really important. And so it's vital that we're able to show that the services and supports we're investing in are successfully improving outcomes for young children. So home visiting programs usually have their own outcomes that they're trying to achieve, and evaluation efforts will focus on those. But some states have also developed common outcomes that all home visiting programs, regardless of the model they're implementing, are trying to achieve. This allows them to show sort of the collective impact of home visiting, which makes it easier to advocate for state funding. The Wisconsin Early Years Home Visitation Project is an example of this. Programs volunteered to participate, and together they agreed on 5 core outcomes and indicators that they would all measure. And in order to do that, they also agreed to use the same screening tool so that they would all be looking at the same measure. And they found this to be very helpful for them in looking at the outcomes that were specifically integrated within the early childhood system. So they were all also tracking things that they needed to for their particular model, but this allowed them to sort of see the big picture for home visiting. Taking this a step further, states can also identify common outcomes for the early childhood system as a whole. This relates to the strategy I mentioned earlier of creating an early childhood vision or a plan, identifying the outcomes you're trying to achieve, and really looking at how the different services and programs that are part of your system are contributing to that outcome is really important. And it often will also show you how coordination will allow you to reach that outcome in a better way. So Washington has a birth to 3 implementation proposal that outlines recommendations for improving outcomes for infants and toddlers, and it includes home visiting as one of the strategies that they recommend. And then the last strategy I listed here is including home visiting in early childhood data systems. So states are really very busy developing data systems, and home visiting should really be either included or connected to these. So you're seeing a full picture of what's happening to the child and how different programs and services are impacting the outcomes you're trying to achieve. Iowa is currently building a home visiting database that they're going to link to their Department of Education's longitudinal data system. So the home visiting database collects data both for state-funded and federally funded home visiting programs in the state. And then when it links to the Department of Ed system, children are identified a Department of Ed unique identifier, and this will follow them when they enter school. So I just wanted to close by very briefly showing you a couple of tools that 0 to 3 developed for our work with states to help them think through their home visiting system. The first one here really lays out the key components of a home visiting system, and it takes states through a number of sections like on needs assessment and program planning, professional development, and early childhood partnerships and collaboration. And it allows states to kind of assess where they are and identify priorities for improving quality and taking steps to improve their system. And then the second one, this community planning tool, we developed after McVie came into place to really help communities think through what capacity they needed to build to really effectively deliver home visiting services. And we worked with states some states actually use this with the communities that receive their McVie funding to help them put that into place. So these are both on our website, and if people in your state are interested in using them, we'd be happy to talk to you about that. So I've just talked to you for a very long time, so I'd be very happy to hear any questions you have or hear what's going on in your state between home visiting and child care. So Michelle, I'll turn it back over to you.
Okay, great. Thank you so much, Jamie. That was a wonderful overview and some great resources, too, that I hope you all wrote down. And if not, we can send in a follow-up email. So it looks like we have a couple of questions here directed to you, Jamie, that I will read out loud here. The first one is, is there anything that mentions home visiting in the President's proposal or the Strong Start Act?
Great question. So the President's proposal had really 3 components. The first being increased funding for public preschool, which is the one that I think most people are hearing the most about, and then partnerships for early Head Start and child care. And then the third component was to increase funding for home visiting. Now, the Strong Start for America Act has sort of an endorsement of that idea of increasing funding for home visiting, but it didn't specifically lay anything out for that in terms of a dollar amount because of the way that the McVie program is structured through the Affordable Care Act. But I don't know if you saw that today there was actually a budget proposal that's supposed to be voted on in the House and the Senate that does include some increased funding for early childhood programs, restoring some of the sequester cuts, and it also has sort of a reserve fund in the budget that could open the door to increasing funding for home visiting when the appropriations committees go to make those decisions.
Excellent. I'm very glad you mentioned the recent budget talks as well. Thank you, Jamie. The second question is, the second and last, unless anyone has another one, please type in now, is when you mentioned how home visiting how home visiting and child care work together. Do they work together primarily in family child care homes or child care centers?
So, you know, the connections with home visiting and child care, often those connections are being made at the local level. And we've seen some of that in both family child care homes and centers. although there are some states and communities that are exploring using home visitors to actually go work with both children and family, friend, and neighbor caregivers. So that's another way that child care is connecting. But there's not a lot of, I guess, formal structures right now that are connecting those two. A lot of it's happening more at the local level.
Great. Okay, thanks. And a couple of requests for this recording and the slides, and we can definitely get that. And I'm actually going to turn the controls back over to me so I can show you all where on our website and our YouTube channel where this lives. So you can make sure to visit our YouTube channel if you want to see the recording again or pass it along, which we definitely encourage. So okay, I'm just going to show the screen here. And if you visit us at usa.childcareaware.org, and then in this tab, Connect with Us, we have all of our different media and social media outlets, and our YouTube channel. We will have all of our Raise Your Hand, including this one, and then within the hour, posted up here. So you can just click on the link and pass it around. It looks like those are all the questions. So you were very clear and to the point. Thanks so much, Jamie, again, for hosting this wonderful webinar. And again, if you all have questions for Jamie, you add her email up, and we will be sending around a follow-up email with all the resources. So thank you to 0 to 3 and to Jamie and to everyone for taking time with us this afternoon to learn about home visiting. Thanks all, and have a great rest of your week. Take care.